Hi there, in this video, I'm going to show you some simple home remedies that you can use to killing nerve in tooth. These remedies are all natural and easy to follow, so stick around and I'll show them to you right now. How to treat tooth pain. Nerve. What is the sensation of a toothache nerve? Dental nerve pain sensations can manifest themselves in a range of clinical manifestations. It may have several symptoms or only one. Pain. Throbbing, excruciating pain that comes and goes. It may feel like your heart is thumping. Constant, slow pain. Excruciating pain. Teeth that are sensitive to heat and cold. You may be running a temperature. Constant toothache may cause you to feel psychologically agitated and weary. What could instantly relieve a toothache? How to treat tooth pain. Nerve. To stop a toothache immediately, either extract the nerve from the tooth or fully remove the tooth. Both treatments will numb the nerve, preventing it from hurting you. You will experience pain relief once you have eliminated the source of your nerve discomfort. Root canal treatment. The tooth will stay in the mouth, but the nerve will exit. You will have rapid pain relief because the nerve is dead. Unfortunately, only your dentist can perform this treatment. Extraction of teeth. This is when the tooth is entirely pulled. There are several methods for removing a tooth, but the most typical is to do so under local anesthesia with your dentist. This is the least unpleasant method because you will remain numb throughout the procedure. As a result of the missing tooth, you will have a gap in your mouth. These are just two methods for relieving chronic toothache pain, because they do not address the fundamental cause, which is an unhealthy nerve. All other methods will only provide transient pain alleviation. Nerves must be treated directly to alleviate pain, rather than indirectly to alleviate symptoms. If you're curious, there are techniques to soothe irritable dental nerves. How to get rid of a toothache forever at home. You might be surprised, but there is one case in which you can hit a dental nerve at home, and that is when you have a really loose tooth that you can physically move from side to side. It appears to be on its way out. Do you remember the old floss technique for removing baby teeth when you were a youngster and your baby teeth were loose? We urge that you see a dentist, but keep in mind that not all teeth extracted in the world have come from a dentist. Loose teeth, caused by severe gum disease, usually fall out on their own over time. Yes, you will have permanent pain relief only when the tooth is extracted. Nerve discomfort caused by a loose tooth. If you are experiencing excruciating dental pain and the tooth is so loose that you can move it with your fingers, consult your doctor. It appears that if you simply cut into an avocado toast, it will come out on its own. To relieve the pain, the tooth must be completely extracted. In 3 seconds, you may permanently erase the pain of a toothache. 1. Dab some Antiseptic around the painful tooth. 2. Wrap the floss around the tooth. 3. Quickly pull the floss in less than a second. 4. You should now have the tooth in your hand. This procedure is only for primary teeth, not mature teeth. Remembering back to your youth, your baby's teeth should be very loose so that you can floss them. Also, please avoid using pliers on your teeth. Since the dawn of time, parents and children have used floss to remove loose baby teeth. Instead, we recommend that you contact your dentist right away so that they can perform the treatment gently for you. Our LIC dentists are extremely skilled in tooth extraction and will gladly assist you. How to temporarily relieve toothache pain at home. Apply a cold compress. Apply ice to the injured side for 15 minutes and then remove it. You can do this as many times as necessary. A toothache might be relieved by applying cold to the affected area. Use salt water to rinse. Add 1 teaspoon of salt to 8 ounces of water and rinse for 2 minutes. Later, spit it out. Rinse with Listerine. After a few seconds, Listerine will eliminate 99.9% of the bacteria in your mouth. According to the manufacturer, Listerine will not treat your toothache, but it will keep the bacterial population under control, preventing it from worsening. Use hydrogen peroxide to rinse. Rinse for 2 minutes with a 1:1 mixture of 3% hydrogen peroxide and water. According to studies, 6% hydrogen peroxide can destroy 50% of the germs in 15 seconds. This will stop the germs from growing any further. Oregano is an essential oil. Apply a drop of oregano oil to a Q-tip and massage the painful tooth for about 2 minutes. Reply as many times as necessary. Oregano inhibits bacterial development and has even been demonstrated to be beneficial against antibiotic-resistant germs. A packet of peppermint tea. Steep peppermint tea bags in boiling water for 5 minutes. Allow the tea bag to cool to near room temperature before placing it on the impacted tooth. Steep for 10 minutes using a peppermint tea bag. According to research, the menthol in peppermint has a modest antimicrobial impact. Fresh garlic. Consume plenty of fresh garlic to help avoid infections. Fresh garlic has also been shown in studies to be effective against antibiotic-resistant bacteria. Thyme and clove essential oils. Apply a drop of oil to a Q-tip and massage around the affected tooth for 2 minutes. Alternatively, a few drops in a cup of water can be used as mouthwash.